Hello everyone, I am Xiao Shen, Clinical Veterinarian and Biosafety Officer of Research Administration of CMU. First of all, I am so glad and it is my honor to see you in this class for sharing about these topics. Laboratory biosafety and the another is use of animals in experimental research. Today we are going to talk in those topics which I introduced to you, but because of limited time in this session, so I'm just talking to introduction of the concepts. If you are interested in the other topic or both topic, you are able to enroll in each training course. Biosafety course can be enrolled via Safety Hill and Environment Center, CMU. The course is training for 2 days. If you have passed or participating in testing criteria, so you will receive a certificate of achievement. For the animal use program is the course of laboratory animal center responsibility. It is divided to 3 courses, and whoever has to use the animal in your research, you should be enrolled for 3 parts. The first, it is a basic knowledge for animal care use and teaching you how to writing a animal use protocol, also known as an animal ethics submission form. The second is biology of laboratory animal, rodent and rabbit handling practice, and the third is substance administration in many routes. Euthanasia, how to necropsy, and how to sampling the organs, something like that. In each course, you are receive a certificate of achievement if you have passed the criteria like the biosafety course. Proclamation before we are continue the session. The biosafety part is not designed to be training tool for personnel who will be working in highly level contaminant environments. Whoever participates in high level contaminant or plan to work in higher than risk group 1, you should be enrolled to biosafety and biosecurity course, which managed training course by CMU. In addition, this course has certified by Departments of Medical Science, Ministry of Public Health, but nowadays we are training in Thai language. Moreover, you are able to follow about cross information from SHE or Safety Hill and Environment Center or Research and International Relations Division of the faculty. Okay, we come back to our topic. Why are we must try to understand the biosafety? And it is the reason the LAI, laboratory acquired infection. Infections have long been associated with working in the laboratory. Some scientists accumulated data from numerous surveys of biomedical laboratories, and by 1978, they collectively reported that a total of 4,079 laboratory acquired infections occurred. Beginning in 1930, out of these, there were 168 deaths. In more than 80% of reported infections, no distinct exposure event was reported. In the following years, several other groups attempt to document the rate of LAIs. One emerging realization was that there was no single course of practice, standards, guidelines, etc., provided to workers that detail how to work with pathogens safely. And the first, biosafety in microbiological and biomedical laboratories, also known as BMBL, was published in 1984, has undergone 6 revisions since then. The BMBL provided the technical content not previously available in biosafety guidelines by adding summary statement conveying guidance pertinent to infectious microorganisms that have caused LAIs. The current edition 6 in the BMBL is also the product of a broad collaborative initiative committed to persuade the value of this national biosafety code of practice. Biosafety and biosecurity. Although the term biosecurity can have a several definitions, the BMBL 6 edition describes the laboratory biosecurity to refer to measures designed to prevent loss, theft, or deliberate misuse of biological material, technology, or research-related information from laboratory or laboratory-associated facilities. And the term of biosafety is related to biosecurity, but they are not the same. Biosafety programs reduce the exposure for workers and the environment to hazardous biological agents. It is achieved through containment laboratory design and access restrictions, training personnel, and safe methods of using to storing hazardous agents. Biosecurity programs may also use these methods. However, the goal is to prevent the loss, theft, diversion, or intentional misuse of infectious agents. Both biosafety and biosecurity program depends on risk assessments, personnel expertise and responsibility, and control and accountability for research materials, access control, training, or emergency planning. The success of both programs hinge on a laboratory culture that understand and accept the rationale for biosafety and laboratory biosecurity programs and the corresponding management oversight. Also, the laboratory biosecurity and biosafety programs may have many similar components. They may also have some conflicts. In some cases, the laboratory biosecurity practices may conflict with biosafety practices, requiring personnel and management to devise policies that accommodate both sets of objectives. For example, standard practice requires that signage be posted at the laboratory door that inform those who may enter or about hazardous agents used in the laboratory. However, it may be unwise to list an agent that, if stolen, could be weaponized and used for bioterrorism. Therefore, it is important to balance the needs of both biosafety and biosecurity when developing both programs for a laboratory biosecurity should not jeopardize or conflict with required laboratory operation. The biological risk assessment, and it is the main point of this session, and it is a key for working safely in biological containment. Whether you will be working in the other research, you must be assess the risk which you face properly. The biological risk assessment process is used to identify the hazard characteristics of infectious or potentially infectious agent or material. If you know the activities that can result in a person's exposure to the agent, the likelihood that such exposure will cause an LAI and probable consequence of such an infection. The information identified by risk assessment will provide a guide for selection or appropriate mitigation, including the application of biosafety level and good microbiological practices, safety equipment and facility levels, and safeguards that can help prevent your risk about LAIs. Working through the risk assessment process, identify best practices for manipulating biological agents, how to integrate multiple containment or protection strategies, and how to respond if something does not go as planned. And risk assessment requires careful judgment and is an important responsibility for directors and principal investigators of microbiological and biomedical laboratory. Institutional leadership and oversight thought is also such as Institutional Biosafety Committee or IBC or equivalent resources. Animal Care and Use Committee, Biological Safety Professional, Occupational Health Staff, and Laboratory Animal Veterinarian also share in this responsibility if the research interact with the animal and pathogens. The CMU IBC is divided to 8 sub-IBCs for review, recommendation, evaluation, research that use biological material, pathogen according to Pathogen and Animal Toxin Act, and policy of public health ministry announcement, which is quite the same on pathogen list in the BMBL book. You are able to learn more about how to submit your proposal for reviewing and approved at this link in your faculty for your information, able to contact personnel who working in the research and international relations division for give your information. This is a sixth step of risk assessment. The six-step approach that gives structure to the risk management process and reinforces an ongoing positive culture of safety. One is identify hazardous characteristics of agent and perform an assessment of the inherent risk, which is the risk in the absence of mitigating factor. Two, identify the laboratory procedure hazards. Three, make a determination of appropriate biosafety level and select additional precautions indicated by the risk assessment. Four, before implementation of control, review the risk assessment and selected safeguard with biosafety professional, subject matter expert or the IBC or equivalent resource. Five, as a part of ongoing process, evaluate the proficiency of staff regarding safe practice and the integrity of safety equipment. Six, revision regardless and verify risk assessment or risk management strategy and determine of change are necessary. The risk assessment, step one. There are a variety of ways that an agent can be hazardous to people, animals, or the environment. The following are considered to be the principal hazardous characteristic of agent. One, the ability to infect a susceptible human or animal host can cause disease. Two, its violence or ability to cause the severe disease. Three, vector preventive measures such as vaccine or treatment. Four, the characteristic of agents can also be used during the risk assessment to determine the appropriate BSL level and the safeguard to use, like probable route of transmission, minimum infective dose, stability in the environment, geographic range of host species, or agent origin. In particular, naturally present in the same geographical area where it is studied, calling in endemic agent, or naturally present in the geographic locations, calling in exotic agent, and genetic characteristic is also considered. For example, the risk assessment for an attenuated or less virulent form of an influenza virus will probably show that it can safely be handled at a lower biosafety level than would be required for fully functional strain. And safety documents from reputed sources are also valuable, such as pathogen data sheet generated by the Public Health Agency of Canada, or PHAC. The next is risk group. The agent may be assigned into the risk group, which are based on these principal characteristics that the route of transmission of the natural disease. The NIH, or International Institute of Health, has classified the agents into the risk group in the policy announcement of Medical Science Ministry. The policy announcement of control agent in Thailand for pathogen in section 18 and animal toxin in section 19 or appendix B in the BNBL publication. Or someone working with recombinant or the synthetic nucleic acid molecule, the NIH guideline for research involving recombinant or synthetic nucleic acid molecule published by biotech and another by US NIH are a good reference for the risk assessment used. It is an important thing to not confuse this risk group with the BSL level. The agent risk group may correlate with, but they do not equate the BSL level. Okay. The next is the genetically modified agent. It is important. It is particularly important to address the possibility that the genetic modification could increase or decrease an agent pathogenicity or affect its susceptibility to antibiotics or the other effective treatments. The risk assessment can be difficult or incomplete because inputted information may not be available for the newly engineered agents. And the last is the cell culture. Workers who handle or manipulate the human or the animal cell and tissue are at risk for the possible exposure to potentially infectious agents that may be present in those cells and tissue. Step 2. In addition to agent hazards, also take into consideration procedure hazards when performing a risk assessment. The principal laboratory procedure hazards are agent concentration, suspension volume, equipment, and procedure that generate small particle aerosols and the large airborne particle cooling in droplets, and the use of sharps. Procedure involving an animal can present a number of hazards such as bites and scratch, exposure to zoonotic agents, and the handling of experimentally generated infectious aerosols. The table shows the different entry routes of the pathogen into the human body and the laboratory procedure that could cause exposures. The most likely route of transmission in the laboratories are direct skin, eye, or mucosal membrane exposure to the agent, parenteral inoculation by syringe needle or the other contaminated sharp, or by bites from infected animals and arthropod vectors, ingestion of liquid suspension of infectious agent, or by contaminated hand to mouth exposure and inhalation of infectious aerosol. And the agents capable of transmitting disease through the aerosol and droplet inhalation is very serious laboratory hazard for all its occupants. They are usually undetected and are extremely pervasive, placing the laboratory worker carry out the procedure and other person in the laboratory at risk of exposure. Step 3. The selections of appropriate biosafety level and the select of any additional laboratory precaution require a comprehensive understanding of the practice, safety equipment, and facility safeguard, and is all described in section 3, 4, and 5 of the BMBL. There will be a situation where the intended use of agent require greater precaution than those described in the agent summary statement. The laboratory director and principal investigator or the assignee are responsible for ensuring that the identified control, such as equipment, administrative control, or the PPE, have been made available and are adhered to or operating properly. Um, or equipment deficiency should be corrected before starting work with the agent. And vaccinations may be recommended for laboratory personnel based on the safety and availability. However, the protection afforded by a vaccine to an individual depends on the effectiveness of the vaccine and duration of immunity. Vaccination does not substitute for engineering and administrative risk mitigation control. The risk mitigations require finding a balanced approach that includes ongoing hazard identification and review of control measures with a commitment at all levels to reduce identified risk to the level correlate to the institution. In Thailand, Pathogen and Animal Toxin Act have four levels of biosafety laboratory. BSL-1 using for risk group 1 pathogens, BSL-2 using for risk group 1, 2, and some kind of pathogen in risk group 3. Moreover, animal toxin and biological material are recommended in this level as well. Level 3 using for risk group 1, 2, 3, and or risk group of animal toxin. BSO4 using for all risk group of pathogen and animal toxin. But if you need to working with the risk group role in Thailand, law and regulation have prohibited unless the PI and facility performance able to support with high risk and before start working in risk group role pathogen must be asked for permission to General Director of Public Health Ministry in case by case. Step 4, before implementation of the control, review the risk assessment and selected safeguard with a biosafety professional such IDC, subject matter expert, or equivalent resource. In step 5, the protection of laboratory workers or the person associated with the laboratory and the public will depend ultimately on the laboratory worker themselves. Staff at all skill level need to know how to identify the hazards in the laboratory and how to obtain assistance in protecting themselves and others in the laboratory. The principal investigator should ensure that the laboratory worker has acquired the technical proficiency in the use of microbiological practice and safety equipment required for safe handling of the agent have developed good habits that sustain excellence in the performance of those practices. An assessment should identify any potential deficiencies in the knowledge, competency, and practices of the laboratory workers, training, experience, knowledge of agent and consider hazards, good habits, caution, attentiveness, and concern for the health of co-worker are prerequisites for laboratory staff in order to reduce the risk associated with work with hazardous agents. Step 6, continue the risk management cycle and adjust and adapt as the needs arises. These include a regular update of biosafety manual and SOP when change in procedure or equipment occur. And the last thing of risk assessment is the risk communication. An effective culture of safety depends on the effective communication and reporting of risk indicators, including incidents and near misses. in a non-punitive manner. Institutions that work with infectious agents and toxins need a appropriate organizational and governance structure to ensure compliance with biosafety, biocontainment, and laboratory biosecurity regulations and guidelines, and to communicate the risks. The principal investigator or facility equivalent has a primary responsibility for communicating hazards and risks in the laboratory. Staff have staff must have the ability to report issues, include incident and near miss without fear and reprisal. Okay, these slides show the DSL levels laboratory. Each of the four laboratory levels or the four types of DSL designation consists of combination of facility design feature and safety equipment, facility practice and procedure, and personal protective equipment. Okay, first is BSL-1 or biosafety level 1 laboratory are used to study agents not known to consistently cause disease in healthy adults. Workers in this laboratory use standard safety practice and standard microbiological practice. No special primary or secondary barrier are recommended other than indoor hand washing sink and non-porous work surface that are cleanable and easy to decontamination. The next is level 2. BSL-2 laboratory are used to study a broad spectrum of biological agents and toxins that are associated with causing disease in humans of varying severity. These agents can safely be used on an open bench provided that the potential for generating aerosol and splash is low. A BSC or biological safety cabinet is used if the potential for generating aerosol exists. Personnel working with human-derived material should refer to the OSHA bloodborne pathogen standard for specific required precautions. Secondary barriers should include those previously mentioned in BSL-1. The next is BSL-3 laboratory. BSL-3 are used to study indigenous or exotic biological agents with the potential for respiratory transmission and those that may cause serious and potentially lethal infection. The primary route of exposure to personnel working with these types of biological agents and toxins relate to accidental exposure via the cutaneous or mucosal route and inhalation of potentially infectious aerosols. All procedures involve the manipulations of infectious material are conducted within the BSC or the other primary containment device. No work with open vessel is conducted on the bench. The secondary barrier for BSL-3 laboratory includes those previously mentioned for BSL-1 and 2 laboratory. They also include enhanced ventilation strategy to ensure inward directional airflow, controlled access zone to limit access to only laboratory approved personnel, and may contain anti-rooms, airlocks, exit showers, and exhaust HEPA filtration. And level 4 laboratories are used to study dangerous and exotic biological agents that pose a high individual risk of life-threatening disease that may be transmitted via the aerosol route and for which there is no available vaccine or therapy. Agent with a close or identical antigenic relationship to agent requiring BSL-4 containment must be handled at this level until sufficient data are obtained either to confirm continue work at this level or to resignate the level. The primary route of exposure to personnel working with these type of biological agents relates to accidental exposure via percutaneous and mucous membrane route and inhalation of potentially infection aerosols. The laboratory workers complete isolation from aerosolized infectious material is accomplished primarily with by working in this class 3, BSc or suit, and the secondary barrier for beta 4 laboratory should include those previous mentioned for previous 4 of biosafety level laboratory. Uh, this is a table showing you about the biosafety level summary. It's described about the agents recommended use in special practice, primary barrier, which is first contact equipment to personnel such as PPE, or secondary barrier, which means start safety equipment and facility design for working safely. Okay, you should be to make your understand by yourself for 2 slides. Okay, this is a standard microbiological practice. There are quite much of a standard practice, and I will show you in this slide. And you should try to understand by yourself about standard microbiological practice. And it is a special practice for working with beta 2 condition. It is a special modern standard microbiological practice for working with the beta 2 condition. And it is a video for show you about how to safely put on personal protective equipment. I think it is quite important for you for working, for prepare yourself for working with this level, especially beta 1 or beta 2. Okay.
How to safely put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown, tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room. How to safely put on personal protective equipment, or more commonly called PPE. How to safely take off personal protective equipment, more commonly called PPE. We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove and glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
Okay, when you're working with BSL laboratory, it's undeniable to work in the cabinet. There are many types of cabinets usually used in the BSL laboratory. You should know how are different between it and different reasons for choosing it for working. It is an introduction to biological safety cabinet. Okay, I will show you.
Part 1. Introduction to Biological Safety Cabinets. Users are always confused on which equipment to select that will best suit their needs. So it is important for them to understand the concept of operations and the difference between the types of equipment. The clean bench, fume hood, isolator, and biological safety cabinet, BSC, are the different types of ventilation equipment used in the laboratory to work with biological agents or chemicals. Clean bench. The clean bench is designed for product protection. It does not protect the environment or personnel and should not be used when working with a biological agent or chemicals. Air is directed across the workspace toward the worker to protect products such as microprocessors. It is not suitable for chemicals or biologicals. It has HEPA filters that circulate air away from the worker. Fume hood. The fume hood is a kind of ventilation system that is designed to protect personnel from volatile toxic chemical vapors and flammable chemicals. The concept is that air is drawn in from the front of the cabinet and expelled outside the building where it is mixed with fresh air. When using a fume hood, a building engineer or technician should be consulted to ensure that the ventilation system of the existing building is adequate for the installation. Like the clean bench, the fume hood cannot be used for biological agents because there is no system to protect the user from biological hazards and it does not protect the product. Isolator. An isolator is a type of enclosed ventilation system that has physical barriers. Internally, it provides a workspace which is separated from the surrounding environment. There are positive and negative pressure isolators. Positive pressure isolators can be used for the aseptic preparation of pharmaceutical products, while the negative pressure isolators are used to protect the operator from hazardous materials such as cytotoxic preparation. Biological Safety Cabinet, or BSC. The Biological Safety Cabinet, or BSC, is a vented enclosure that is used in laboratories to minimize the exposure of laboratory personnel to aerosols or droplets while they are working with infectious agents and toxins, IAT, or biological select agents and toxins, BSAT. It is important to certify cabinets annually. The BSC contains two major components: the motor blower system, which controls the airflow and compensates for filter loading to provide a constant volumetric flow rate of air; high-efficiency particulate air filters, better known as HEPA filters, which have a minimum particle removal efficiency rate of 99.99% on particles smaller than 0.3 microns, remove bacteria, spores, and viruses. BSCs are designed to provide three types of protection, including product protection, personnel protection, and environmental protection. I will discuss each type separately. Product protection. The downward flow of HEPA-filtered air across the work surface of the cabinet in a single direction at a constant speed or laminar flow. The downward moving airflow splits as it approaches the work surface. The fan draws part of the air to the front grill and the remainder to the rear grill. This split generally occurs about halfway between the front and rear grills above the work surface to prevent cross-contamination. The air drawn through the front grills creates an air curtain to protect the contaminated air from getting into the work area. Personnel protection. Airflow is drawn into the front grill as an air curtain along with the sash provides protection to personnel working in the laboratory. Environmental protection. Because cabinet exhaust air is passed through a certified HEPA filter, the cabinet is particulate-free, providing for environmental protection. Types of BSC. There are three types of biological safety cabinets: Class 1, 2, and 3. I will discuss types 1 and 2. Class 1. BSC Class 1 cabinets have exhaust air that passes through the HEPA filter. They offer personnel and environmental protection from biological agents but do not offer product protection. Class 2. The BSC Class 2 cabinet is the most commonly used for working with biological materials because it can provide all three types of protection: personnel, product, and environmental. BSC Class 2s are classified into four subtypes: A1, A2, B1, and B2. BSC Class 2 Type A1. has a minimum inflow air velocity of 75 feet per minute through the front opening with an exhaust approximately 30% of the total air handled and recirculating to 70% in the cabinet. For cabinets built after 2008, they now come with biological ducts and plenums under negative pressure or surrounded by negative pressure ducts and plenums. Class 2 Type A1 cabinets are not suitable for work with volatile toxic chemicals and radionucleotides. BSC Class 2 Type A2 have a minimum inflow air velocity of 100 feet per minute through the front opening with an exhaust approximately 30% of the total air handled and recirculated to 70% in the cabinet. There is negative pressure or surrounding negative pressure in the ducts and plenums to contain the biologically contaminated air in order to protect the environment if there are any leaks at the exterior surface of the BSC from IATs or BSAT. The recirculated and downflow air is vented outside through a canopy unit. Therefore, the cabinet can be used with biological agents containing minute quantities of toxic chemicals and trace quantities of radionucleotides without interfering with work. BSC Class 2 Type B1 cabinets have a minimum inflow air velocity of 100 feet per minute through the front opening with an exhaust approximately 70% and recirculating air of 30%. The exhaust cabinet air must pass through a dedicated duct to the outside through a HEPA filter. Additionally, there is no internal blower for exhaust and air must be vented outside through a hard duct. BSC Class 2 Type B2 cabinets have a minimum inflow air velocity that is 100 feet per minute through the front opening, with no recirculation of the air. There is exhaust of 100% of the air to the outside after filtration through a HEPA filter. There is no internal blower for exhaust and air must be vented outside through a hard duct. This type of cabinet may be used as an adjunct for microbiological studies with biological agents that require treatment with toxic chemicals and radionucleotides. In conclusion, the concept of BSC operations revolves around how the blower works and the efficiency of the HEPA filter. The laboratory supervisor and responsible personnel, including the BSC user, should understand the general principles to operation and proper maintenance of the cabinets. BSC field certification tests must be performed on each cabinet at the time of installation and at least annually or whenever the HEPA filters are changed. Maintenance repairs are made to internal parts or when the cabinets have been moved.
Prior to starting work in a BSC, schedule uninterrupted work time if possible, and collect all of the laboratory materials that will be needed, such as absorbent pads, a biohazard waste container, pipettes, pipette tips, microfuge tubes, a vortex, a small sharps container, paper towels, and whatever else you may need. Place these materials on a cart next to the BSC. A plastic squirt bottle with disinfectant will also be required. For the purposes of this training, we are using a generically labeled disinfectant bottle. Use and label disinfectants based on OSHA requirements. For information on labeling and best practices, consult your supervisor or safety office. First, confirm that the UV light is turned off. Then, check the expiration date on the BSC certification. BSCs must be certified when installed, whenever moved, and at least once annually. Next, turn on both the fluorescent light and the blower motor. Confirm that the alarm button is on, and open the sash and set it to the proper height, as noted on the outside wall of the BSC. The BSC sash alarm will sound if the sash is set too high. Next, make sure the drain valve handle is perpendicular to the valve body, indicating that it is closed. Allow the cabinet to run for at least 4 minutes in order to purge the air of particulates inside the BSC. If the BSC has a pressure differential gauge, also called a magnehelic gauge, this may be checked and recorded. Compare the reading to what was recorded previously. Gradual changes will generally occur over time due to filter loading, but a sudden change in pressure reading indicates that there is a block or breach of the filter system. Perhaps most important, this reading should never be zero. If this happens, the BSC should not be used, and you should contact your safety office. Some labs keep a pressure gauge log taped on the BSC and record the daily readings. That way, you can see quickly if there has been a significant change from the previous day. Inward airflow should be verified prior to use. You can use a smoke generator, or you can tape a tissue to the bottom of the sash. The tissue should be drawn into the cabinet to show inward airflow. Once the cabinet has been running for at least 4 minutes, gather the necessary supplies for decontamination and place them inside the BSC. Decontaminate the inside using an appropriate liquid disinfectant that has been approved as effective against the infectious agents you are working with and has been designated in your laboratory SOP. Clean all of the surfaces with a liquid disinfectant and disposable towels. This includes the side walls, the back wall, the inside of the glass on the sash, and the work surface. It is not recommended to spray disinfectant inside the BSC because the mist can be drawn internally into the grills or HEPA filter, and this can cause pitting of the stainless steel parts inside the BSC, or it can cause damage to the HEPA filter. It is better to generously moisten the towel and wipe the surfaces, allowing enough contact time for the disinfectant to do its job. Contact time will vary depending on what is being used. Discard the used towels into the biohazard waste bag. Don't ever put your head inside a BSC. If you can't reach the back wall, use an extendable mop and then discard the used disposable mop cloth into the biohazardous waste container. If bleach has been used as a disinfectant, wipe the BSC surfaces again with water or 70% ethanol to remove any bleach residue. This is because bleach is corrosive and can pit the stainless steel, which can provide an ecological niche or environment for microorganisms to evade cleaning and disinfection. Once you have completed disinfection of the BSC, dispose of your gloves in the biohazard waste container. The stool or bench should be adjusted to ensure that your face is above the sash opening and that your armpits are level with the bottom of the sash. As a reminder to perform these tasks, a BSc checklist may be used according to your lab's protocol. After you have completed your initial decontamination, preparation, and checks of the BSc, you can begin work. Remember to wear PPE appropriate for the work you will perform. Some groups require that you line your immediate work area with absorbent plastic back material to prevent contamination of the work surface and facilitate cleanup. That practice is determined by a risk assessment and SOPs, but do not allow this material to block the front or rear air grills. Before loading the BSc, it is a good practice to wipe the external surfaces of all needed supplies with disinfectant to reduce the introduction of outside contaminants into the cabinet. It is recommended to load necessary materials once in the beginning to minimize your arms entering and exiting while working. Don't forget a biohazardous waste container, sharps container, paper towels, or wipes. Remember the clean to dirty principle and place clean materials on one side of the BSc and the biological waste and sharps container on the opposite or dirty side. In this video, we are demonstrating placement of materials for a right-handed person. Materials will be reversed for a left-handed person. Remember to keep the front and rear grills unobstructed to avoid disrupting the airflow in the BSc. Items should be placed as far back in the cabinet as possible without blocking a rear grill. While working in a BSc, you should be seated, and only one person should work in the BSc at a time. If two people need to work in the BSc at the same time, the BSc must be a minimum of 6 feet wide in length, and a risk assessment must be performed and documented. Sit down at the BSc and adjust the height of the chair so your face is above the opening and behind the glass. Your arms should be bent at a 90-degree angle at the elbow while inside the BSc. Some BScs are designed to allow your arms to rest on the front part of the BSc to avoid fatigue or ergonomic injuries over time. Older BScs that do not have a built-in armrest can be supplemented with a separate armrest that is designed to be placed on the BSc front opening or is attached to the front grille. If used, the BSc should be certified with them in place. Use a foot support if your legs do not reach the floor or if needed for back comfort. Minimize entering and exiting the BSc. If you need to exit and enter the BSc, pull your arms straight out and insert your arms straight in, perpendicular to the opening. This will minimize air being pulled out of the cabinet and into the breathing zone of the person sitting at the BSc, as illustrated previously with the smoke machine. Please note, some laboratory SOPs may require you to remove your contaminated gloves and place them in the biohazard container prior to exiting the BSc and put on a new pair of gloves before re-entry. Be sure to protect the vacuum line. This must include using a HEPA filter and capping unused lines. Airflow in a biological safety cabinet, or BSc, can be interrupted, altered, and changed by many different factors. These interruptions can lead to potential exposures and/or product contamination. This is a smoke generator. It is used to demonstrate how airflow is affected by operations inside and around a BSc. But first, let's look at what proper airflow looks like. For proper containment, air is drawn into the cabinet at the opening and then down into the front grille. Together, the sash and inward-flowing air provide an air curtain or barrier that is intended to keep cabinet air and room air separate from one another. To protect the work product, the cabinet's downward air is cleaned by a high-efficiency filter within the cabinet. Upon reaching the work surface, roughly half of the downflow air moves toward the front grill, and the other half moves towards the back grill. The physical location of the BSC can affect the airflow as well. Placing a BSC too close to a doorway can cause the air to be drawn out of the BSC when a door is open. Placing a BSC too close to an HVAC supply vent can also interfere with the BSC containment. Proper sash height is critical because when the sash is kept at the proper height, the appropriate inward airflow can be maintained. The proper sash height is designated in the BSC operation manual and should be clearly indicated on the BSC. The performance at the BSC at the declared sash height is actually part of the cabinet certification process. If the sash is too low, inward air velocity will increase at the opening, which can cause turbulence and potential contamination inside the cabinet. If the sash is set too high, an alarm will sound. This indicates the inward air velocity may slow down to a point that it cannot provide and maintain containment at the sash opening. This could cause contaminated air to leak out of the cabinet or room air to enter the BSC opening, mix with the downflow air, and potentially contaminate the work product. Even when the sash height is correct, the air barrier at the opening is fragile, approximately 100 feet per minute or 1 mile per hour. It can be easily disrupted. Something as simple as the way you withdraw your arms or a person walking too close to the cabinet can pull air and potential contaminants out of the cabinet and into the breathing zone of the person working in the BSC. One common mistake is overloading the inside of the BSC with too much equipment and/or supplies, or covering the front or rear grills. Another way to disrupt airflow is by using a flame inside the cabinet. This is not a good idea for two reasons. One, the heat from the flame can cause air currents inside the BSC and interfere with proper airflow. And two, flames are a fire hazard and can damage the HEPA filter. For these reasons, flames should not be used inside a BSC. Once you have completed your work, you will need to decontaminate all of the materials inside of the BSC and the BSC itself. This is all done while the blower motor is on. The first thing that needs to be done is close all the containers. Next, using the same disinfectant used to clean the cabinet before work started, generously apply disinfectant to the materials in the cabinet. This can be done directly to the materials, or by moistening a towel and wiping the surface of the materials, starting with the least contaminated items first. Please note, samples should be surface decontaminated or placed into secondary containers that have been surface decontaminated prior to exiting the cabinet. Please allow materials to remain wetted for the appropriate amount of contact time. After the appropriate contact time is passed, remove any residual wetness and place the materials that will remain in the cabinet on the designated clean side of the cabinet. If a blue absorbent pad was used, discard it into the biohazardous waste container by grabbing the outer corners of the pad and folding it inward. Remove other materials from the BSC, placing them on your cart. After removing everything from the cabinet that needs to come out, proceed to decontaminate the inner surfaces of the BSC as you did before beginning work. Don't forget the sides and back wall, as well as the inside of the glass sash. To remove the biohazardous waste bag or container, moisten a paper towel with disinfectant and carefully wipe the outside of the bag and/or waste pan. Depending on the type of autoclave, load, and cycle, it may not be necessary to add water to waste bags before autoclaving. Institutional policy will determine specific practices based on validation or verification of the appropriate autoclave operation and performance in your facility. Dispose of the paper towels and gloves, and allow for the appropriate amount of contact time. Next, add the recommended amount of water to the biohazard bag, and then loosely gather the opening of the biohazard bag and loosely tape it. The reason you loosely closed it is because you don't want it completely sealed when it goes into the autoclave. If it is, then the steam will not be able to penetrate the bag, and the contents may not be decontaminated. If only a biohazard bag was used, remove the bag and place it into a waste pan outside of the BSC for autoclaving. If a bag and a waste pan were used, remove both from the BSC. Leave the blower motor running for at least 4 more minutes to purge the air. After 4 minutes, turn off the lights and blower and close the sash. If you have a UV light, you may or may not turn it on, as per your SOPs. Some labs will leave their BSC blower motor running continuously. In that case, you could turn off the light, but leave the sash open. If your lab keeps a usage log, be sure to sign the BSC log form. One final note. Each lab should have established schedules and SOPs for routine cleaning and any routine maintenance not requiring an outside contractor. Non-routine maintenance or repairs will be handled by a contractor designated by the Safety Office. Laboratory staff members should be aware of their responsibilities and establish policies necessary to maintain the BSCs, and they should consult the Safety Office for any needed guidance.
The next is transportation of infectious substance. The shipper and carrier must be trained on this regulation. Shipper and carrier must be trained on this regulation so that they can properly prepare shipment and recognize and respond to the risk posed by these materials.
The classification of your samples will determine how you package them. Today we are looking at a Category A and Category B.
In the instance of an FMD exclusion request, Category A sample packaging is required when there is a high index of suspicion with clinical correlation. Category B packaging is suitable for FMD exclusion samples where there is a limited clinical correlation.
Regardless of their classification, all biological samples must be packaged in a triple pack system. I'm going to demonstrate that for you now. Take your samples, place them into your biohazard bag, and ensure that you place adequate absorption material that should they spill or open during transport, the entire contents will be absorbed. This package is then placed into your secondary receptacle and is sealed. And your secondary receptacle is placed into your styrofoam box. You'll also include an ice brick or 2. This will ensure that the integrity of the samples are maintained at 4 degrees. And you'll also need to include sufficient packing material to prevent the secondary parcel from moving around. Place a lid on your styrofoam box and transfer your styrofoam box to your outer packaging. At this point in time, you'll need to also include your SAS and the appropriate IATA documentation on top of the parcel and seal your box. Category A boxes must have the UN mark on them and must be purchased from an approved supplier. You'll also need to include the outer markings and labellings on your parcel. These are the shipper and the consignee information, a 24-hour emergency contact name and number, the UN number, as well as the proper shipping name. You'll also need to ensure that your infectious substance label is present on the box. Should your parcel contain more than 50 ml of liquid, you'll need to ensure that orientation labels are present on the box. This ensures that during transport, the package will remain upright at all times. Category B boxes can be any cardboard box as long as it's passed the 1.2 metre drop test. What you do need to ensure is on the box includes the sender information and the receiver information, a 24-hour contact. This includes a name and a number. You need to include the words biological substance, category B, on the box somewhere, and you'll need to ensure that the UN 3373 mark is present. Same as a category A, if the parcel has 50 ml or more liquid in it, you will need to include orientation labels.
Okay, the next is decontamination and disinfection. Decontamination render an area, device, item, or material safe to handle in the context of being reasonably free from risk of disease transmission. The primary object of decontamination is to reduce the level of microbiological contamination so that transmission of infection is prevented. The definition and capabilities of each inactivation procedure are discussed in Appendix B. Decontamination and disinfection of laboratory surface and item in the BMBR book, which you further study in the BMBR book. And the next two slides are for emergency response and situation of spill outside the BSC and spill in the BSC, how to respond.
Cleaning up a spill involving bloodborne pathogens or sharps is a dangerous task. Follow these steps to ensure a safe cleanup. The first step is to stop and survey the area of the spill. What are you dealing with? Is there anyone seriously injured? Is there blood or other material that might harm you? If someone is injured, he or she is your first priority. Next, find your equipment, like a biosafety spill kit. You'll need at least a lab coat, gloves, and eye protection to ensure your safety during the cleanup. If there are any sharps around the spill, pick them up with either tongs or tweezers and place them in a sharps container. Just be sure to use something that will effectively separate your skin from the sharps. If there's a lot of blood, remember that more spilled material equals more splatter, so use additional protection if needed, including disposable overalls, booties, or face shields. The next step is to clean up. Before cleaning any bloodborne pathogenic material, use your tongs or other tool to remove any sharp pieces. Then carefully cover the spill with absorbent towels, making sure to lay them out in a single layer. Spray a tuberculous disinfectant onto the towels, making sure to use enough to soak through. Allow time for the disinfectant to work, which is usually around 10 minutes. Now, wipe up the spill from the outside in. If sharps are present, use something other than your hands. Smaller pieces may still be present even after larger pieces have been cleaned up. Repeat the above steps until no more material is left. Disinfect the spill area again and allow time for the disinfectant to work before wiping with paper towels one more time. The next step is to dispose of the waste. After the spill is cleaned up and paper towels and other waste is disposed of, spray the outside of the sharps container, the biohazard bag, and the tongs with disinfectant. Remove PPE, starting with gloves, then the lab coat, and then eye protection. If your hands become contaminated in the process, be sure to wash them before removing another piece of PPE. And lastly, wash your hands one more time after all PPE is removed.
If there is a spill inside the BSC, it must be cleaned and decontaminated promptly. Wearing appropriate PPE is crucial for this. Standard operating procedures, or SOPs, should be developed in advance for how to respond to spills. Cleanup of large spills, or spills that occur in parts of the BSC that are difficult to access, for example the drain spillage trough or catch basin, may require assistance from the safety office. The following demonstrates a general procedure for small spills that occur on the work surface. This procedure may need to be adjusted according to the specific work being performed and your laboratory SOPs. The first thing you should do is cover the spill with an absorbent material such as paper towels. Using a plastic squirt bottle, carefully apply the designated liquid disinfectant in your SOP to the absorbent, starting at the outside of the spill and moving toward the center in circular motions. Wipe up as much of the spill as possible and discard the towels in the biohazardous waste container. Then, repeat the process with more paper towels and disinfectant, this time leaving the wet paper towels on top of the contaminated area for the appropriate contact time to allow for disinfection. Contact time will vary depending on the organic material and specific infectious agents present, the type and concentration of the disinfectant, the concentration of the agent, and other variables. Discard the paper towels in the biohazardous waste container. If bleach was used, swipe the surface with ethanol or water to remove the residual bleach and prevent pitting of the stainless steel. If objects inside the BSC came in contact with the spill, they must also be decontaminated. Apply disinfectant to paper towels and wipe the exterior surfaces. Make sure the objects are wetted for the proper contact time before resuming work.
Okay, the next topic is use of animal in experimental research. It is the same previous topic because we have a short time, so I have just talking in the principle of animal care and use guideline. For more information, you should further reading in the guide 8th edition. First of all, I am going to talk about histories of the guide. The guide for care and use of laboratories animals, current published by the National Academy Press, was published in 1963 by the U.S. National Institute of Health. The guide has undergone 7 revisions since its initial publication, and the last version was written by a committee appointed by the Institute of Laboratory Animal Research, or ILA. The purpose of the guide is for accessed institution in caring and using animals in ways judged to be scientifically, technically, and humanely. Okay, in 1959, Russell and Bruce published a paper outlining the principle of working humanely with laboratory animals. These principles, known as the 3Rs, have become internationally accepted as the foundation on which scientists should base their research with laboratory animals. The 3Rs are replacement. Replacement is the method that avoids using animals, for example, using the tissue or cell culture, computer modeling, or replacing vertebrate animals with invertebrate animals. The next is refinement. Refinement is modification to procedure of animal that enhance animal well-being and reduce or eliminate pain and distress. For example, using restraint for a shorter time during a procedure or using more effective or longer-lasting analgesics. The next is reduction. Reduction is use of fewer number of animals without compromising scientifically valid results. Advance in statistics or refinement of experimental design may lead to a reduction in animal required. These are the concepts of animal ethics which are derived from three principles. For more detail, you should try to understand each topic in this slide by yourself. It is a simple thing. The next, I would like to talking about animal care and use program management. The components of the animal care and use program, there are three main parts. One is a IO, instructional official. The IO has the authority to allocate about resource, about personnel, about financial to the program. So it will make the program run effectively. Two, the attending veterinarian or AV is responsible for the health and the well-being of the laboratory animal use at the institution. Okay, and the third is the IA group. I would like to talk in next slide. About the IA group. IA group or institutional animal care and use committee is the group of person working like IBC for evaluate, for approving about animal care, animal use, or practice about animal for make animal well-being in all the period time of research. The component of the IA group is first is doctor or veterinarian certified or with training and experience in laboratories, animal science, and medicine, or in the use of species at the institution. At least one practices scientist with research experience using laboratory animals. At least one member from a non-scientific background, at least one public member not affiliated with anyway with research institution to represent community interest in animal welfare. The exercise of IA group is determined by the nature and extent of the program. However, no more than 3 members should be derived from any single administrative unit within the institution. For the IA group function include review and approve of proposed animal use protocol, review and approval of proposed significant change in animal use protocol, regular inspection of animal facility and use area, regular review of the program, ongoing assessment of animal care and use, or instituting the mechanism for receipt of animal care and use concern and reviewing any received concern. Okay, about that for the IA group function working. And the CMURA group, it is a process of submission and review the animal use protocol. For your information more, you are able to surfing at this link for understand the process to approve animal use protocol or contact Assistant Secretary of CMU Animal Care and Use Committee. You can call number 053-948-621 for about information about how to submission and approve the animal use protocol. These are the topics of animal use protocol reviewed by IA group for approving the protocol. In this slide show many points of concern about the use of animal in the research, such as purpose for use the animal, sequential description about the procedure on animal, uh, justification about the species, number of animals, about unnecessary duplication of experiments, how to husbandry the animal, impact on the animal well-being or the proposed procedure, about criteria for when animal will be removed from the study or euthanization, euthanasia method and disposition of animal, including consideration of long life species after conclusion of study. Okay, something like that. I would tell you in each topic. There are some procedures within animal protocols that will require special and careful consideration by the IA cook during their review. Opportunities for addressing the 3Rs should be considered under these circumstances. The following are some examples of such procedure and situations. Experimental and human input is when the objective of the study has been met, whereas the human input is when pain or distress is prevented, terminated, or relieved. For many experiments, the human and experimental endpoint are very close. Using the human endpoint to contribute to refinement that would result in severe animal pain, distress, and death. Using human endpoint contribute to refinement that would result in severe animal pain, distress, and death also. The veterinarian and the IA cook should be involved in this process. Some project or some research that we didn't know for all of them. The pilot study may be approved by the IA cook for determining appropriate human endpoints of the particular project or in particular model for starting and observing frequently or strictly for animal well-being in the pilot study. The next is surgical restraint. Prolonged restraint should be avoided unless it is absolutely necessary to achieve research objectives and must be approved by the IA cook. Less restrictive restraint methods should be employed whenever feasible. And the guidelines for prolonged restraint include restraint is not to be considered a normal method for housing and must be justified in the animal protocol. Restraint devices are not used for convenience. Alternative to restraint should be considered. The period of restraint should be minimum amount necessary to accomplish the scientific objectives. Animals should be trained using positive reinforcement to adapt to the equipment and personnel. Animals that fail to adapt to restraint should be removed from the study. Observations of the restrained animal should be made at appropriate interval during the period of restraint. Veterinary care should be provided if lesion or illness occur and may necessitate temporary or permanent removal from restraint. And personnel involved in this study should be provided with clear explanation of the purpose of duration of the restraint. The next special consideration is multiple survival surgical procedure. Multiple major survival surgery is a long word. On one animal care is only acceptable if they have been scientifically justified and included in the IF-approved protocol. This applies to all animals covered by the guide, and it is important. Cost saving alone is not justify multiple major surgical procedure. It um, is not reasonable. According to the guide, the definitions of major survival surgery should be evaluated on a case-by-case basis by the veterinarian and the IA cook. Therefore, the guide definition is somewhat flexible. However, the animal welfare regulation have very specific definition for major operative procedure, which is any surgical intervention that penetrate and expose a body cavity or any procedure which produce permanent impairment of physical or physiological function states that no animal shall be used in more than one major operative procedure unless justified scientifically and in the same protocol. Some studies, the regulation of food or fluid is required. This may entail scheduling access to food or water during specific times of the day, or restricting the amount of food or water given during normal feeding and watering times. The least amount of restriction that will achieve the research objective should be used. For protocol with food or fluid regulation, the IA must have evaluated about level of food or food regulation that is necessary, potential adverse effects, appropriate method of measuring the health and well-being of animal being regulated. The animals should be monitored closely to ensure that nutritional needs are being met. Body weight should be taken and recording at least 1 week during restriction, and rating records maintained to document daily food and fluid consumption, hydration status, and any behavioral or clinical change that would signal removed from the study. And about pharmaceutical grade chemical, the guide clearly states about pharmaceutical grade chemical and the other substance should be used when available for animal related procedure. You can uh, learning or the first study in page 31 in the guide 8th edition. Sometimes this will not be possible. However, the use of non-pharmaceutical grade substance should be described and justified by approved animal use protocol. Okay, I am give some slide about conditions of animal husbandry, but I wouldn't talk about that. If you're interested in, you able to enroll animal training course for further study. So you please skip many slides to this slide 34. Okay, and we are come back about surgery, surgical. Okay, I think it is some important point for you. The definitions of surgical procedure in the guide may be summarized as three categories. The first is major cerebral surgery, such as laparotomy or laparotomy, like penetrate in the abdominal cavity, thoracotomy, joint replacement, limb amputation, around that, about penetrate and expose the body cavity, produce substantial impairment of physical or physiologic function, or involve extensive tissue dissection or transection. About that is calling in major cerebral surgery. And the next criteria is minor cerebral surgery. It is does not expose a body cavity and cause a little or no physical impairment. This category includes wood suturing, peripheral vessel cannulation, percutaneous biopsy, routine agriculture animal procedures such as castration, and most procedures routinely basis veterinary clinical practice, something like that. And non-cerebral surgery is an animal is euthanized before recovery from anesthesia. Okay. However, the guide leaves room from the IA cook and veterinarian to classify some type of procedure, minor and major, on case by case. For example, laparoscopic technique that produce a little tissue trauma may be considered minor, whereas laparoscopic procedure should be considered a major, such as hepatic lobectomy, about remove the lobe of liver out of body, okay, something like that, or cholecystectomy. Aseptic technique is used to limit microbial contamination as much as possible during surgery. Aseptic technique involves many practices and procedures and require the input and cooperative of all personnel who enter the surgery area. For all species, aseptic techniques include patent preparation such as hair and feature removal, disinfection of surgical sites, surgical preparation such as wearing appropriate surgical suit, sterilized gloves, something like that. Instrument, supply, and implanted material sterilization, and use of operative technique to reduce the potential for infection. It is an important thing. When sterilization instruments and other materials to be used for surgery, sterilization indicator should be used to validate proper sterilization. Some alternative methods, such as hot bead sterilizer, used for batches of rodent surgeries, are appropriate. Okay. Intraoperative monitoring includes routine evaluation and recording of anesthetic depth, body temperature, heart rate, and respiratory rate and pattern, and also heart rate, so you are recording a pattern also, and blood pressure. And maintenance of the blood pressure is important during surgery, as is body temperature maintenance, especially in small animals. And the post-operative monitoring is important part of post-surgical care. The frequency of monitoring will depend on species and the procedure that was performed. post-operative period might require greater intensity of monitoring. Post-operative animals should recover from surgery in a clean, dry, comfortable area where they will be observed by trained staff. Appropriate document of monitoring parameters should be maintained in a medical record. In post-operative period, particular attention should be paid to thermal regulation, cardiovascular function, respiratory function, electrolyte and fluid balance, management of pain and discomfort. After initial post-operative period, animals should be monitored of sign or pain of infection, and the wound size should be checked for detection about separate of the wound. Suture, staples, or wound clips should be removed after appropriate amount of time. The prevention or alleviation of pain is vital component of a laboratory animal. Pain causes stress and, if unrelieved, can lead to unacceptable level of pain and distress in animal. The proper use of anesthetic and analgesic is absolutely essential when working with animal use for research. The National Research Council's publication, recognition and alleviation of pain in laboratory animal is an excellent resource on this topic. In general, unless the contrary is known or established, it should be considered that procedure that cause pain in humans may also cause pain in the other animals. Therefore, it is essential that personnel working with animals able to recognize clinical and behavioral signs of pain in the species that they are working with. Depending on the species, some of these signs include vocalization, lack of dreaming, anorexia, rapid labor respiration, porphyrin staining, pink stain around the eyes and the nostril is abnormal. Selections of appropriate anesthetic and analgesics depends on professional veterinarian judgment, scientific requirements of protocol, and use preemptive analgesia, which means use analgesic drug for control in many pathways of pain. Okay. Use the preemptive analgesia enhanced patient stability during after surgery and post-operative pain is reduced. Chronic pain may be more difficult to control. However, commercial options are available for slow release of analgesics. Animals should be closely monitored for signs of pain because there is considerable individual variability in the response of analgesic in each animal. Nursing support and non-pharmacological control of pain may also be effective. About who use the eyes at the pain size, something like that. Okay, when the anesthetic administered, consciousness is lost before perceptions of pain is lost. Therefore, it must be verified that the animal cannot feel pain before surgery begins. Personnel may need to test more than one response to pain reflex. Sedative, anxiolytic, and neuromuscular blocking drugs do not relieve pain. That's important. However, they may be useful in combination with analgesic and anesthetic to provide balance and anesthesia and to minimize stress in the animal. Any use of neuromuscular blocking drug must be evaluated by veterinarian, and the appropriate amount of anesthetic must be ascertained prior to using the neuromuscular blocker. Okay, the last slide, yes. Euthanasia. Euthanasia is the act of humanly killing animal by a method that induce rapid unconsciousness and death without pain or distress. The animal should be euthanized with methods that are consistent with the AVMA guideline for euthanasia for animals, unless an exception is scientifically or medically justified. The criteria for euthanasia are listed in the protocol, which should ensure that the endpoint is humane and, whenever possible, allow specific objectives to be accomplished. Animal distress should be avoided when euthanasia is performed. Fetus and larvae should be received special consideration during euthanasia, depending on species and gestation age. Agents used for euthanasia should be appropriate for the species, age, and objectives of the protocol. In general, chemical methods such as use barbiturate or inhalant anesthetic agent are preferred over the physical method that use the cervical dislocation, decapitation, but it is the hard thing, but sometimes it's appropriate for some species, for some age. Okay. Even though carbon dioxide is commonly used to euthanize rodents, its acceptability should be evaluated as new data become available. As its use is controversial, neonatal rodents require longer exposure time to the agent, to the carbon dioxide, and the secondary or alternative method should be considered. Okay, they are usually use the physical method as a secondary euthanasia, and it is essential to people who perform euthanasia are skilled in the appropriate method of euthanasia for species involved, and date must be verified prior to carcass disposal. Supervisors should be aware of emotional effect on personnel who may occur when perform euthanasia in many animals. Okay, and secondary euthanasia method can also be used to ensure that date has been achieved. Or euthanasia method should be reviewed and approved by the RA cook and veterinarian, also the primary euthanasia method. I have two assignments for you, and I think it is quite important for someone who will working in the animal research or pathogen in the BSL2 laboratory. Okay, the first question is, the first assignment is, how is the process for getting a risk group 2 pathogen research protocol reviewed to be approved by the CMU IBC? 2. How is the process for getting an animal use protocol reviewed to be approved by the CMU ACUP? You can describe in 1 or 2 pages per assignment and submit the answer to my email on the slide before 18 August. Okay, so finally we are done for this session, and I hope this both topic will make you understand in big scope of concepts. Besides, if you are interested in this topic or both topic, or you have to use the certificate to guarantee your knowledge, you're able to enroll the course that I told you on the start session. Thank you for your attention. Goodbye everyone. สวัสดีครับ ขอบคุณมากๆนะครับ